Reverse shoulder replacement is really indicated for patients, initially it was indicated for patients with a disease process called rotator cuff arthropathy. And all that means is they have bad rotator cuff with a bad joint. So arthritis in the face of a big rotator cuff tear. Reverse shoulder replacement means that we're switching the anatomy of the shoulder around. Instead of the socket being the socket, we put the ball at the socket, and then the ball of our shoulder becomes the new socket. The shoulder in and of itself has the most range of motion of any joint in our body, so it's considered what's called an unconstrained joint. The shoulder is really constrained by the soft tissues around it. So a reverse shoulder replacement converts the shoulder to a more semi-constrained joint. So you now have a true ball with a partial socket. And what that does is it makes the deltoid muscle a little bit stronger. It's like stretching a rubber band just a little bit tighter so that it springs a little bit more. So by tensioning the deltoid a little bit tighter, it allows patients to lift their arm up and overcome the deficiencies that are caused by a torn rotator cuff. It's done in an inpatient or outpatient setting. Surgery takes roughly an hour to do. Patients will come in, they'll have their surgery, anesthesia will numb their arm up, they are under a general anesthetic. Pain relief has been tremendous. The goals of this surgery are really for pain relief and also some degree of function. For the patient that comes in and has what's called pseudoparalysis of the shoulder, which basically means that they can't lift their arm up as a result of a massive rotator cuff tear, this has been a really big game changer in terms of restoring function to that patient's arm. So patients, and I've had many patients who were facing the decision of going to an assisted living from an independent setting where this surgery in and of itself prevented them from having to go to an assisted living facility.